when you got here. What'd you find?
Well, there was interesting challenges. There was clearly some concerns about the financial state of the organization in particular, as the hospital was struggling with how they had managed some COVID funds that they had to repay. It had a big impact on the ability of the hospital to meet some of its financial obligations. So that was a big issue. The CEO at that time was pursuing some ventures that probably didn't make a whole lot of sense for the hospital. One of which probably, had it been implemented, probably would have violated some federal statutes. Then there was another one in terms of behavioral health that really was not going to meet the needs of the community. It was more of a tele-behavioral health program that served Boulder County. And so as we kind of looked at all those ventures, it was clear that the hospital was going in a direction that wasn't making a whole lot of sense for the organization in terms of its financial position and in terms of serving the community.
Not only going in a direction, but going into a pretty dire direction too, off a cliff really. I mean, we saw at the end of last year a pretty dire situation. How bad was it?
Well, it was. I mean, obviously, we obviously ended up, once we figured out as we're getting the audit completed for 2021, which was delayed, they ended up losing about $2 million in 2021. And I think our preliminary numbers for 2022, there's probably going to be a loss in excess of $2 million again. There was just a failure to monitor the key financial indicators for the organization. Just an absence of data. I think my biggest challenge, even as I was doing the assessment, was getting my hands on financial data that was meaningful, so we could really assess where the organization was at. And so it was complicated. I mean, a lot of that was driven that they implemented a very complicated new financial system at the beginning of 2022, and it didn't work. And so that just made it that much harder for anybody to see what the hospital was doing in terms of financials. One of my concerns in the assessment is that department heads didn't have budgets. They had no idea in terms of what they had to spend for the year. There was no monthly reporting of, okay, you're over budget, you're under budget. So everybody was kind of driving in the dark, which you just can't do that in a hospital.
No, you definitely can't. I mean, it sounds like you're saying there was a failure of financial systems, a failure of leadership.
Well, definitely a failure of financial systems. I can't. I mean, it's hard for me to make a judgment about the leadership. I mean, my sense is they must have known that the finances were not where they should be because they didn't have the data.
Are you willing to say it was previous leadership's fault?
I'm willing to say if I were the leader, I would not have been making the financial decisions they made. Every CEO has their own management style, but I think I've had 40 years of healthcare experience, and I would never have run a hospital in the way they did.
When you walked in, started learning department heads don't have budgets, were an unknown amount of dollars in the hole for 2021. What was going through your head? What did you think when you saw the situation here?
Actually, I was disappointed. I mean, I guess I kind of have a high regard for quality healthcare leadership, and to see that somebody really missed the key indicators for driving the hospital. I felt bad. I felt bad for the hospital. I felt bad for the board because they were put in a position that they should not have been put in. I felt bad for the community. I mean, the community had great expectations for this organization, and the failures of the leadership really put this facility in a precarious position.
Do you think it can be fixed?
Oh yes. I keep telling people there's absolutely no reason why the hospital should be in this position. It's the right size market. When they built the new facility, it was downsized from being a much larger hospital to being an 8-bed hospital with lots of emphasis on outpatient services. And so the big thing is just to get kind of the operating systems in place so that revenues meet expenses, or expenses meet revenues, one of those two. And so it's just a matter of really getting caught up with the accounts payable and getting some contracts fixed. So yes, I think it's very positive. We've made a lot of changes. We've significant reductions in staffing. We've canceled a lot of contracts that were really superfluous to what we're doing.
So it sounds like you're saying it can be turned around.
Yeah, yeah.
You mentioned the new building. That's something that we've heard from community members and from outsiders too, who are looking at this and saying, wow, they've got a brand new hospital building, and yet had points in time when they couldn't pay staff. Is the new building partially responsible for the fiscal issues?
Not much, not really. I mean, I think a lot of payroll, when I look at the historical data starting in kind of the end of 2021, payroll expenses almost increased by about 60%. I mean, there was just a huge growth in staff. It was just extra, lots of staff. A very top-heavy organization. I mean, I looked at, they had, vice president or vice presidents, assistant director. It was just a top, lots of management layers that you wouldn't see in an 8-bed hospital. I mean, I've been in 350-bed hospitals that didn't have as top a heavy a structure as we had here. So we really have spent the last 8 months really kind of right-sizing the organization chart to match what we have here. So.
I want to get into that in a moment, but I also, some of the things Karen sent me some really helpful background information. Obviously, what brought this to our attention at first was some of the issues in December with making payroll. Tough to make payroll. Are vendors unpaid at this point?
Yeah, there's no question. There's vendors that we're working out repayment plans on. There's some. We've been working really working very closely with the key vendors that help us keep the door open on a day-to-day basis. There are some vendors that I know have been waiting for many months to get any kind of payment. So we're really trying to, as we address some of our revenue issues, try to work out repayment plans with those vendors. And it's tough. In my career, I've never had to do this. Reach out, have these conversations with vendors, saying, "Look, we're sorry, we haven't paid you in the last 5 or 6 months. Can we work out a payment plan?" And fortunately, most of them have been very agreeable to that. But again, this is a new experience for me. So.
Yeah. And what kind of vendors are we talking about here?
Oh,
from plowing the front.
Yeah, actually, we do our own plowing, so that's the good news. But from pharmaceutical suppliers to people who provide maintenance on some of our equipment. The people provide the rugs in the lobby so they don't get tracked, they don't get paid. The local restaurant that provides food, the meals for our patients. We actually have a payment plan with them, but there was a period there where where she wasn't getting paid. Again, it's a small business, and at this time of year, it's a slow time of year for them. So it's been hard for us to as we try to take care of our patients, we're really trying to take care of the vendors as well. So.
Other points when supplies have run low.
The biggest supply issue has really been on the pharmaceutical side, and again, I think we've now recently fixed that. There were a couple of times where some of the pharmaceutical suppliers said, we will take your order if you pay us in advance, and so we're getting caught up with some of that
because of the lack of payment in the past.
Yep.
Interesting. Anything ever impact patient care?
No, that's one thing we have worked so hard to protect to make sure there's patient safety has been protected.
Let's talk about what's being done to try to pull St. Vincent out of this.
Sure.
What are some of the key points that you've made changes?
Well, obviously, reducing our cost structure. So I talked about reductions in FTEs.
So that's 50 full-time employees, right?
Yeah. I'm looking. I'm trying. I forget. I actually had a dollar value for the payroll, but I can't remember what it is right now. So we canceled a lot of contracts. A good example, we had a contract for anesthesiology services, for CRNA services for the surgery. This was a contract that we were paying for the service as if we had surgery going on here all the time. Well, the OR had been shut down for a number of months because we ran into this altitude issue, but we still continue. We still kept racking up the bills. Mm-hmm. So we're in the process. We've suspended that contract, and we're looking at contracts where we can bring in CRNAs when we need as needed. So it's on the day we have surgery, we pay to have the CRNA there. So it's those types of decisions in terms of the managing the expenses.
Was there a number you were looking for payroll?
Yeah.
Was it old compared to new? Is that what you're
Yeah.
It was around $1 million a month, and now it's about $660.
Yeah. Yes. Yep.
Do you mind just saying that again?
Sure.
How
Yeah.
much has payroll
Okay.
changed?
So payroll this time last year was just over $1 million a month. And right now I think it's about to drop down to $720,000 a month. So that's $300,000, just almost $300,000 a month times 12. That's $3 million in reductions in payroll. So that's a big number.
Is that painful to cut the staff?
Yeah. The good news is we had enough people. We had a lot of people who left. Obviously in healthcare you get lots of churning anyway of positions, so we made the decision to say, okay, this position is vacated, can somebody else assume the responsibilities? So we had a lot of those opportunities. Probably the biggest reduction in staff is they had hired this large group of behavioral health counselors that came on board in August, and I think there was 20 or 25 people in that group. And we eliminated those positions in the fall. And that was probably the hardest one because they had great expectations in terms of what being part of the hospital, and there had been some great promises made to them that probably weren't realistic. And so to sit down and say, gosh, we're sorry, what was sold to you was not realistic, and clearly was not serving our community.
It sounds like you use the word right sizing, which I think sometimes people don't quite understand, but it sounds like you're saying we're just going to get back to the basics.
Absolutely. That's the best way to describe it. I think there was a vision that St. Vincent Health was going to be this much grander organization, and they were going to they were going to have this lab service that was going to serve Colorado and Arizona, and obviously the behavioral health program, and it was just going to be huge. And in the meantime, they really lost focus on, okay, how do we take care of primary care, serving the Lake County residents? How do we just get the basic things done? And that all got lost in this grand vision.
It sounds like some of the basics include making some of the basic paperwork. Are we billing correctly?
Yeah.
Are we certifying physicians correctly? Are we making sure that we can cross our T's and dot our I's to get paid? Are those things fixed now?
Well, we're making headway. Obviously, it's interesting. The organization, they implemented this financial system, which is designed for a much larger organization, and we're in the process of trying to cancel the contract for that. We've actually gone to QuickBooks to manage our financial system. For the size of this organization, QuickBooks actually works very well, and it's very user friendly. In terms of, I actually lost. I'm sorry, I lost my train. So back. Yeah. So in terms of, I think that some of the financial leadership that was here at the end of 2021, they didn't have an appreciation for the requirements for a lot of the credentialing for providers. And you get this national provider identifier, and actually up until recent years, I didn't appreciate how rigid it is, and you really need to make sure that all your T's are crossed and your I's are dotted when you make your applications, and that wasn't done. So there was a period when they brought on the primary care clinic at the beginning of last year. there was 3 or 4 months where they weren't getting reimbursed for the primary care services because the credentialing hadn't been taken care of.
So they were doing services but not getting paid for
Correct,
them because
correct.
they didn't do the paperwork right.
Yeah, right. Same thing, the ambulance service, we had the same issue that they you know, the ambulance service had its own MPI.
Oh, sorry.
Might be important. It's just like switching up just a little. Okay, can we restart?
Yeah, so let me say that again. So you were saying ambulance.
Oh, so the ambulance service, it had its own MPI. Well, they did something. They tried to they kind of tried to merge the MPI with the ambulance service for the MPI with the hospital, and Medicare and Medicaid and the payers said that's not acceptable. So again, there was a period where the ambulance service was being offered, and we weren't getting reimbursed for the service. Now the good news is we're now, I think, looks like we're going to be able to go back and get back paid for that. So anyway, all those pieces are getting fixed, and I can guarantee you that our team, they're following the MPI stuff incredibly closely and making sure the insurance companies know about it. One of the interesting challenges is that we found with the ambulance service with the credentialing is that we have on this campus, we've got the old hospital, the new hospital, they have different addresses. And so they did the paperwork for the ambulance service. They used the mailing address, but they didn't use the hospital address. And so that, because of that, the MPI wasn't, the claims were being rejected. And so we had to go back through and change make sure that all of our paperwork reflected the actual hospital address rather than the mailing address.
So they were missing pretty basic stuff.
Yeah. Of course, I have to admit, it's pretty silly when you're on the same campus that the address that,
To have two different addresses,
yeah,
but still,
yeah,
once
but
the first kind
that's-
comes back,
yeah,
you figure it out.
Yeah. So anyway, so we lots of attention to those basic things. We've brought in an outfit that specializes in all the revenue cycle stuff in terms of credentialing, and I mean they really know their stuff. And what's important about them is, we have an electronic health record and a revenue cycle system. They're all integrated. This company, their only clients are people that have this particular system, and it's really been clear as they're really starting to ramp up in the last 3 weeks. They're giving me data that I have not been able to see, nor has anybody else been able to see, to say, okay, here's what's going on in terms of revenue. Here's what's going on in terms of claims being rejected or the coding wasn't accurate. And so, the team actually is going to be on site next week, and there's going to be a lot of training going on to really get after all those really critical elements to make the hospital work right.
I have a couple of more kind of nitpicky questions and then big picture.
Sure.
So some of the smaller things, how long is it going to take to get St. Vincent out of this hole?
Well, essentially, we were talking with actually the gentleman that's going to be helping us with kind of the management of the hospital. His experience is it takes about 3 years. The first year you spend really identifying the problems. We keep saying we're going through the layers of the onion, trying to identify all the problems. The second year is trying to fix those problems, and the third year you really start reaping the benefits of that effort. Now, I'm hoping that the effort that myself and our interim CFO have done, working with the staff the last 6 months, maybe we can have a really good jump start for the management company when they actually come on board.
So you're hoping to get a little bit ahead of it. But
Yeah.
At this point, how many years did you say?
3. So, it's a slow process. And the frustrating thing is that it took them. It really has probably been a 2 to 3 year process, if not longer, in terms of digging the hole that's in it. And we all want an immediate repair, but stuff is pretty complicated.
You talked about pulling back layers of the onion. Something that some folks in town have raised concerns about is that some of the actions of the previous CEO or CFO might have amounted to fraud or something against the law. Is there any indication that anything was done illegally?
No, I don't. I get. We keep looking to see if there really is something illegal. I think the closest thing they came to was this agreement with this laboratory where they were going to be doing genetic testing. It had the potential of being illegal, but we stopped it before it ever really got implemented. Because I mean, our lawyers looked at it and said, yes, this is clearly, if you implement this, it'll be in violation of the federal anti-kickback regulations. So we stopped that. But I think everything else, I just think it was just bad management decisions.
You're here now.
Yeah.
You're taking the reins. How often do you get up to Leadville?
Not enough. For personal circumstances, I really need to be at home most of the time, but at least once a month, twice a month. I am Zooming 3 and 4 hours a day with people here. I keep telling people I think I get more work done by working remotely rather than being on site. The downside is I don't get the interpersonal interaction that you have being on site. So.
Big picture, you've worked in a lot of hospitals. What does this hospital mean to this community?
Well, today I'm not sure. I mean, I think the community has always loved the hospital. I mean, it means it's the legacy. I mean, it goes back a long time. So, and the fact that I think they were excited about having the brand new facility, I think the image with the community is a little bit tarnished, or maybe a lot bit tarnished, given the financial challenges. I think what I see my role and the future role, the role of the future management is we've got to turn that image around so the community once again really respects the facility for what it's doing, and we're working hard on it. We keep talking about fixing things. We're also now we're really trying to get the surgery program going again. We're working with some of the systems in Colorado to bring back a cardiology specialty clinic and an OBGYN specialty clinic and a spine surgery clinic, so that people can see that this really is a place to come to get your health care.
Do you think people should be concerned that they won't get the care they need here?
No. We've got all the right resources. We've got the right personnel, and again, everything we have done is to make sure that we offer quality care.
One point is our ER doctors are our trauma physicians from the Front Range.
Yeah.
Do you want to make that point?
Yeah, no, that's a good point. Yeah. So yeah, obviously the emergency room is a really strong point for the organization, and we have a contract with a group of emergency physicians. It's called CarePoint, and they provide 24/7 coverage in the emergency room. And again, in my career, particularly working in small hospitals, I've never been blessed with having this kind of resource in the emergency room. Typically in critical access hospitals, you've got the primary care physicians that are in the clinic, and then, by the way, they also have to do ER duty covering at night or on the weekends. And this has been just a great opportunity for the community, because you got docs. I mean, they know emergency medicine better than anybody else.
Sure, that's what they do.
And they're just like that. So it's great. So.
Austin, what are we missing? Anything that comes to mind for you?
In a community this small, how important is it for the people of the town and the county to trust what you're doing and trust that it's going to get back to where it was 3 years ago, 4 years ago?
That's a really tough question. Obviously, the hospital needs to keep being open and with the community in terms of what we're doing to fix things, and I think we've tried to do that. We're trying to get better communications in place with the county commissioners, because they've been very supportive, and we're just trying. The big thing is to keep telling our story of what we're doing. We've been blessed. We've had a ton of organizations that have supported us. From obviously the Colorado Hospital Association, the state of Colorado with the Healthcare Finance and Policy Division has given us lots of support.
What keeps you doing it? I mean, this is hard work. Unraveling this mess.
It's fixing it. It's a challenge. Again, I guess I'm not sure what I said, I have never seen a mess like this before, and I think I just kind of took it on as a personal challenge that, this should not have happened, and it's fixable, and whatever I can do to make it succeed, whatever resources I can help bring in to make it succeed just keeps me going. So.
And especially, and it's important to the town too. I mean, Austin was alluding to this on a night like tonight.
Yeah.
If someone has an emergency, they need to rely on being able to access care, and this is a place that provides it.
Yeah. No, it's you know, there's certainly that this community can be very isolated at times, and particularly in the wintertime. And so yeah, it is very important. And I think my sense is that Leadville has changed. You know, again, since COVID, I think the mountain community, all the mountain communities have kind of changed. They've gone through this transformation, and so I think you have a lot more people here who are really need to rely on the facility. So.
Anything we're missing, John, that you think we should talk about? Make sure to talk about. I know we covered a whole bunch.
Yeah.
I have something on, at least if you don't use it, but on record of him having gratitude for our staff who have stayed during these uncertain times.
Yeah.
Because they went without a paycheck, or
Right,
they
yeah.
almost did.
Yeah.
Almost went without a paycheck for a little bit, and some left.
Yeah, you know.
What does it take to keep working in this environment?
Well, I think people who keep working here love doing what they're doing. Most people work in healthcare. They're not necessarily there for the paycheck. They're there for taking care of people. So that's, you know, that keeps it going. And we have worked really hard to make sure that we protect the employees and making sure they get their paychecks.
Is it still week to week whether they'll be able to get paid?
There's been a couple of pay periods where it's been kind of close. We're now in the process of a financial arrangement where we can get better access to our tax revenue, which will give us a cushion for the payroll issue. And we've got some employees who have, the salaried employees that aren't necessarily doing patient care, who are willing to actually have volunteered to cut back on their hours just to help with the organization. So that helps. Yeah. Our interim CFO, she has deferred her paycheck. Because she knows that this is a sizable project, and one that's valuable to the community, and it's a salvageable project as well.